Assalamu alaikum. For this session, we will start with soft tissue injury. So, in this session, we will start with the wound. There are some definition of wound that we will discuss. So, the wound, it means that any injury to the soft tissue anytime the soft tissue is damaged or torn. So if there's torn or damage to the soft tissues, it is a kind of wound. The wound, it might be either open wound or it might be closed wound. What we mean, what's the difference between open wound and the closed wound?
Open, the blood come outside.
Is it necessary to have blood outside or?
Open the body.
So open wound, يعني, it is either region or laceration or elevation. So we will see how is it. Closed wound, any injury of the soft tissue in which the outer layer of the skin. So it depends on the outer layer of the skin. If the outer layer of the skin is intact, not damaged, in this case it is called a closed wound. So this is the difference between open wound and closed wound. Open wound, there is the integrity of the outer layer of the skin is damaged. So the layer of outside layer, they are damaged in the outside layer. In what other thing? In the open wound also there are other issues that we are feeling from. Like what? What we are feeling from when there is an open wound?
Inflammation.
Yes, pain. Pain will be there on both if it is a closed or open wound. But if the infection, so infection, it will be because contamination, it will be more if the wound is open. If the wound is closed, contamination from outside, it is excluded. So this is the issues. So closed wound is an injury to the soft tissue in which the outer layer of the skin is intact and soft tissue damage occur beneath the skin. So the damage is under the skin. The open wound, there are type of the wound like abrasion, laceration, and avulsion. We will see what we mean by that. Abrasion is a wound characterized by the skin that has been scraped or rubbed out. This will happen when the children are playing. Sometimes when they fall down, there will be friction between their body and the surface of the playing ground or the ground. So that friction, it will lead to some scrap of the skin. So mostly in this case, it is only the outer layer of the skin is affected. So sometimes either minor oozing of blood will be there or oozing of serous fluid will be there. So it is from the minor wound, but it depends also upon the surface that's affected, the size of the surface. So in this case, mainly we are in need to clean it well and use some disinfectant. Sometimes it will dry by itself, sometimes no need to wrap it or use a dressing over it. It depends upon the site and it depends upon also the size of that wound itself. So laceration wound, Laceration is a cut usually from a sharp object. By the way, this is the definition which is there in the book. But laceration as a term, laceration, it means that a wound which has irregular edges, that deep might be deep and it has irregular edges. For this cut, usually we call it a cut wound, or we call it a surgical wound, or a wound done by sharp instrument. So it is on a cut. That also it might be deep and it might be superficial according to the depth of the instrument. So it is made by a sharp instrument. There is what we call it the avulsion. Avulsion here is a wound in which a portion of the skin and sometimes other soft tissues are partially or completely torn away from the body. So it might be, it might happen during accident, those who are working in factory, in cutting instrument, with cutting instrument, in road traffic accident, sometimes due to those accidents, sometimes it might be lead to some what we call it avulsion. So the either finger or even a limb like the hand or the leg, it might be hanging. So it is not completely cutted out, but it might be hanging. It's difficult to see some views like this, but as a first aider, you have to deal with it, and you have to know how to deal with it. So this is one of the cases. See the finger; it is just hanging from one side, so it is not completely cut. So severe avulsion is there. There are, from the wounds, we have what we call it the embedded object. Embedded object, that a sharp instrument is embedded in the body parts. It can be anywhere. It might be stick, it might be a branch from a tree, it might be a knife. So there are any instrument, if it is embedded inside the body. Here, what do you think? If we find any case like this, if it is a piece of wooden piece, if it is a nail, if it is a knife, what we can do? Can we remove it?
No.
Why?
That will give you.
So we should not remove it at all, because when we are trying to remove it, sometimes the injury will be more, and also bleeding might happen, and we might not be able to control the case. So what we can do, we have to wrap it by bandage as it is and transfer the client to the hospital as while the object is there. So we have to immobilize it. We have to prevent it from moving, because also movement of the object, it will lead to more injury. So any cases of embedded object, regardless to the type of the object, it is always advisable not to remove it. Just you have to wrap it. If bleeding is there, control the bleeding and transfer him to the hospital, or you have to call for emergency people in order to take over. But you have to do also this procedure before they came. Until they are coming, then they will transfer him and they will take the precaution. What soft tissue injury mean the one, as we said before, that basically this refers to the injury of any part of your body other than the bone and joint. This includes also sprain, strain, avulsion, amputation, puncture wound, and wound. Puncture, it means that there is a wound, either it is penetrating or non-penetrating. Penetrating, sometimes if we step over a nail, sometimes it might enter our foot just slightly. Sometimes it might enter and come out from other part, from the dorsal of the foot. Punctured wound, also gunshot. It might enter from a side and come out from other side. So when we are dealing with sprain of what we mean by sprain and strain. Strain, there are ligaments that hold the joint together. So in our body part, each joint, it is fixed, the bone are fixed together by ligaments. Those are the ligaments there. So they are fixing the bone together. And they are also coordinating in the movement and keep the alignment of the bone and the body. So the shape of and the movement, it will be in a normal position. But if some tear is there, sometimes also you find deformities will be there. So a ligament are tough strands of tissue that hold bone together. A tear or injury to the ligament, it is called sprain. So sprain, it is a tear in the ligament. If anybody, sometime his legs is swing to side, so this will make a pressure on the ligament, and it will lead to some strain and stretching of the ligament. Sometimes it might be not only stretching, it might be stretching and also cutting of the ligament fibers. In this case, what we have to do as a first aid, if you find somebody after injury, he has a strain. Is it painful or not?
Painful.
Definitely, he has pain. What other signs that might be there? Either if it is in the leg or anywhere. What other sign?
Red skin. Red skin.
Red skin also, it might be change in the skin color. Painful.
Can't move.
Yes, swelling will be there. So it will, there will be swelling. So all the signs of inflammation will be there. So what we can do in this case, we have to immobilize the body part. And we have to elevate it. Immobilization, when we immobilize it, when we fix it, by that we will decrease the movement, so we will decrease the pain that the patient is having. When we elevate it, we prevent the more escape of fluid in the tissue, so by that we will decrease the possibility of swelling. So by that we will decrease the pain. We can decrease the pain and decrease the swelling by use of what?
Ice.
Ice. So we have to use ice or cold compresses. That will help to contract so the blood vessels will be contracted, and it will prevent the escape of fluid to the tissues, to the surrounding tissues, and it will be helpful for them. Then we have to call for help, and we have to transfer the client to the hospital for further treatment. By the way, strain, it need a care or need a treatment or protocol similar to the fracture. When we are dealing with a ligament, it is similar to the fracture. So after that, when they do an X-ray for the joint, there will be nothing is there in the bone. But even though it doesn't mean that plaster of Paris should not be used. They are usually fixing it with plaster of Paris similar to the fracture. Why? Because it will take a long time, and sometimes it might need, if there is a severe tear of the ligament, it might need to do a surgical operation, further surgical operation at the hospital in order to fix the ligament together. Strain, it is similar to sprain, but here the tendon, it is the tendon of the muscle. To at the end, at the head of the muscles, there are tendons that fix the muscle with the bone. So strain is tendon or which is also a tough standard of tissue that connect the muscle to the bone. An injury or tear to the muscle or the tendon, it is called the strain. So the strain, it is either injury to the muscle fiber or to the tendon that fix the muscle to the bone. It will give also the same sign, similar sign to strain. Sprain. So it is similar in that swelling will be there, pain will be there, sometimes difficult, also difficulty in movement will be there for that claim. And the treatment protocol, it is similar. We have to fix it, immobilize it, and elevate the body part, and using ice for it in order to decrease the swelling and decrease the pain. Sprain and strain first aid, as we said, you can recognize strain and sprain by the swelling, and sometimes bruising is there, and pain in the site of the injury. So strain and sprain can be serious, and you should get help for them. If you suspect some one may have strain or sprain, remember the acronym RICE. RICE, it means it is not rice for biryani. So it is rice for rest. So she has to be kept at rest, or the organ has to be kept at rest. Ice should be used to the ice, it will decrease the sensitivity and it will decrease the pain, and also it will decrease the blood supply to the area, so the infiltration of fluid, it will be less, so it will prevent the swelling. Compression using bandage, strap bandage usually, and elevation. So rise, it means here rest, use of ice or cold compresses, compression, and elevation. This is the protocol for dealing with strain, and spray. But for cold or ice, sometimes there are some bags, which is the dry method of cold compresses. There are some bags which contain some material that it will keep the temperature or the coldness for a long period of time, which is chemical substances will be there, not water. If it is available, you can use it. If it is not there, we can use ice in plastic bag and put it over, but not to put it directly over the tissues, especially if there is injury of the tissues. So we have to be protected. It have to be in or in a plastic bag, and that plastic bag, it has to be wrapped with a piece of cloth. So rice, never apply the ice directly to the person's skin as it can cause tissue damage. Always keep something like towel or bandage between the ice and the skin to protect it. Ice helps the injury, as we said, by reducing the swelling, and after the swelling dies down or came down, after about 24 hours, you can start applying heat to the injury. So ice, usually we are applying it for the first 24 hours in order to decrease the blood supply to the area and to minimize the escaping of fluid to the tissues. But after that, we want the fluid which escaped already outside to come back. So usually also it depends upon the type of injury. Sometimes it might be after 48 hours, it might be after 2 days that we can use hot compresses in order to enhance reabsorption of the fluid, which make the ideal. The amputation or avulsions, amputation is cutting away. It is complete cut, the amputation of any body part from the body of the limb or the production of structure, any structure. An avulsion is tearing away of segment of the skin that it will be hanging. So often amputation and a fused body part can be reattached if we take the person quickly to the medical institution or to the surgery, so it can be attached again. Since amputation and avulsion body parts have no blood supply, so you must act very quickly to save and treat the wounded part. If the body part is outside, so no blood supply is there. And the tissues, it need oxygen and nutrition in order for the survival of its tissues. So what we can do with the amputated part when we are taking it along with the client to the hospital? What we can do with it? How we can save it? How we can prevent the tissues from degeneration? What we can do? What do you expect? What kind of thing that decrease the metabolism of the tissues? Say it out. Just try.
the part careful.
Sorry?
Touch the part careful with the part.
No, it is already outside, so it is cutting. Well, what we can do?
Use the bleeding by
We will reduce the bleeding. We will deal with the client, but the body part which is outside. But how we will deal with it?
keep it in the ice.
So yes, we have to keep it with ice. We have to minimize the metabolism. How we will metabolize that? When it is cold, it means that the metabolism and the need for oxygen will be less. So how we will put the ice? Can we put the ice directly over it? زي ما if we are having fish from the market, we put the ice over it directly, or meat. You have to put it in a plastic bag and then waterproof bag, so the ice should not be in direct contact with the tissues, because also the water, it will affect the soft tissue, the cutted tissues. And after that plastic bag, we will put around it the ice. So there should be some insulation between the between the cutted part and the ice. Treating amputation and avulsion. So after controlling of bleeding with direct pressure, elevation, pressure and bandage, and also pressing in the pressure point, we have wrap the amputated or avulated body part in a dry, sterile gauze. Place the wrapped body part in a plastic bag, and then put the bag in another bag over the ice. Don't place the body part directly in the ice, because this will cause damage to the tissues. So for the client, if bleeding is there, we have to control the bleeding. For the part, we have to wrap it with sterile gauze, or a sterile cloth, or at least a clean cloth that we have, and put it in a plastic bag, and that plastic bag we have to fix it well and put ice over it. So it is like this. It is wrapped, put it in a plastic bag, and the ice is over it in another plastic bag, or whatever we are having, another container, whatever we have that we can put ice over. But the ice should not be in direct contact with the oil. The embedded object, as we said before, when an object such as knife is embedded in a person, remember the rule number 1. Don't remove the object. So the object should not be removed at all. The only exception to this rule, when the object is threatening the airway. So if it is threatening the airway, blocking the airway, in this case, the client will die because he is unable to breathe, such as embedded going to the cheek. So in this case, we have to remove. Embedded objects, we have to expose the injury by cutting away the clothes, by putting away clothes around the object in order to expose the area. Apply thick, bulky dressing around the object to stabilize it in its place. So we will wrap around it in order to keep it in its place and prevent it from any movement, because any movement, it will increase the injury of the tissues. Wrapping supporting bandage around the dressing to hold it in place. And we have to be sure that bleeding is not there. So we have to control the bleeding. We have to wrap it until the bleeding is stopped. And transfer the client to the hospital for further treatment. Third one, they will remove it in the hospital. Why they will remove it? Because they have there for ready for the surgery. If any injury is there, if any bleeding blood vessel is there, they can deal with it. But as a first aider, you didn't have the opportunity, or you didn't have the facilities to deal with the further injury. The foreign body, in one of the things that sometimes we might get some foreign body in our eyes. Foreign body, when it is irritant, whenever any small foreign body is there, even dust, you will start tearing, will be coming out, and your eye will be red, and those issues, it will come out. So if irritation or object end up in the eye, it can be painful. You can use tip to flip the upper eyelid back to get a better look at the eye. So somebody, they are expert in flipping out the eyelids in order to see the foreign body if it is there. Flush out the eye gently with flowing water. So we are using flowing water to flush out the eye. So we can open the tape and we can just let the water coming out. If eye drops, sterile eye drops, like normal saline eye drops, we can use the eye drops. It will lose or smoothen the or help for a small object in the eye. It can help to remove. If there is scratch or the surface of the eye or corneal abrasion, apply patch or goes over it. So we have to cover the eye and transfer him to the hospital and try not to do anything with that. If embedded object in the eye, this is sometime might happen. What we can do, we should not also remove it. We should not interfere with it. Regardless if it is small or large. If it is a pen, sometimes it is a pen or a knife or whatever is it. If it is a nail, or so we have to close both eye and we have to fix it in order to. Why we have to close the both eye? We have to use the bandage and we have to close the both eye. Because the two eyes, usually when we are not moving one eye alone. So if we are keeping the other eye open, the movement and running of the eye, it will lead to movement of the other eye. So when the eye is moved, it means that also the object will be moved and it will cause more pain. So we have to do everything over both eyes. So if an object is implemented in eyeball, do not remove it. Pad around the object and apply dressing to hold it in place. Rather dressing over both eyes, and we said the purpose of that because the eyes, in order to prevent the two eyes from moving. Extruded eyeballs. If the eyeballs is outside of the socket, also don't attempt to bob it back in place. Place a moist dressing over it and cover it with a cap, and again place dressing over both eyes and transfer him to the hospital. Sometimes the tooth are coming out. You're falling down. So sometimes some of the teeth it might came out. Not a broken teeth. If it is a broken, it is difficult to refix it. But if it is totally coming out, there is a possibility of insertion of it by the dentist or reattach it. So if a tooth is knocked out of your mouth, and you can often replace it if you get to dentist immediately. So place a moist folded up gauze in the place with the tooth was, and keep smooth the tooth in a glass of milk and bring it along with to the dentist. Either glass of the milk, even the saliva of the patient can keep it alive. So we can use any of them. About bleeding from the nose or epistaxis, رعاف. It is طبعا a term, medical term used to nose bleeding, which is epistaxis. In this case, what we can do in case of epistaxis or nasal bleeding?
Take finger. Take finger.
If we take finger like that, what will happen?
Stop the
It will stop bleeding. Huh? This is the first time that I hear that. Just that we put the finger like this, it will prevent the bleeding? No. The bleeding will come over your finger. Yeah. So you have to catch both sides of the nostrils, and you have to press over it. The tips of your finger, the edges of your finger should touch the edge of the bone here, beside it, and press firmly for 2 minutes at least. This will help in stopping of bleeding. Don't do on and off, because if you are doing like this, the purpose of the compression is in order to close the blood vessels. The blood vessels, usually it is under this side, the blood vessels. So when we are pressing, we are closing the blood vessels, and we are letting the normal physiology of the body to take place. So clotting will happen. If we are just closing and opening, compression and decompression, in this case, what will happen? The clotting, it will not be fully formed. So the bleeding will continue. Is there any other thing that we have to do?
with ice.
We can put ice over the head of the client. By the way, what are the causes of why epistaxis might happen? Why it is happening to certain one rather than other? It might be due to hot weather, so due to dryness of the mucous membrane. It might be due to recurrent infection of the nostrils, recurrent rhinitis. So it will lead to irritation of the soft tissues inside, and the soft tissues that will be weak. It might be due sometimes to foreign body. especially in young children. Sometimes young children, they might enter some foreign body inside their nostrils. While they are playing, sometimes might be competition between them. Who will be able to enter this thing inside? They will do it, and it might lead to bleeding. You know, once we find a girl, she entered the small battery, the remote battery inside her nose. For what, we don't know exactly what. For recharging. So you might find those things. Some of the children also, they are playing with their nose. They are picking their nose sometimes. And when they are picking their nose, it is from the bad habits that they are doing. So also it might lead to injury of the soft tissues, because it is a smooth layer inside that. So if we find, or if we observe our children using this type of picking nose, and sometimes also they might use the pencils or the pen, they might insert it inside their nostrils. So we have to advise them not to use that. We have to explain to them what might happen in those cases. So if the bleeding is really severe and not controlled by pinching the nose, place a gauze and Vaseline inside the nostril. So in this case, we will use a nasal pack. We will complete just this part, and after that I will give you a break. So sometimes the bleeding will not stop. So what we can do, if it's severe bleeding is there, we can use a piece of gauze and put over it Vaseline and insert it inside the nostril. Nasal packing, we call it. It will help in order to close in order to do compression from inside. Sometimes it might be unilateral, it might be bilateral, that bleeding. In old client, it might be due to hypertension. So those who are having hypertension, they might have epistaxis. In this case, it is not only the treatment of the epistaxis with the person, he has to go for medical treatment, and he has to take hypotensive drugs, and he has to take his hypotensive drug regularly and to control his bleeding. It is unfortunate that he got a bleeding from his nose and not having CVA or stroke, bleeding in the skull or over the brain, because in this case the consequence is different, and he might have in this case paralysis. So I told you that I will just finish this part, and I will give you the break. The other thing, which is chest injury, if object is penetrating the chest, air in this case can come out the space between the lung and the chest wall. If this happens, you may hear sometimes sucking or sound on the patient's breast or the air movement. This is called a sucking chest wound, and it can collapse the lung. So in this case, we have to immediately close it with any piece of cloth or anything or any plaster, and transfer him immediately to the hospital. So it might lead to what we call collapsed lung. The lung will be collapsed. So So it might be due to gunshot, it might be due to injury, it might be due to road traffic accident and fracture of ribs. So all of this might lead to those. A laceration, which is small intestine or part of the intestine, it might come out in case of some injury. So in this case, don't return it back. Just cover it with a moist cloth, moist gauze, and transfer him to the hospital. Risk of complication of soft tissues. Bleeding might be there, either it is external bleeding or internal bleeding, crushed injury, and infection. We will later deal with the bleeding. Okay, thank you.